living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
MDs, PAs, RNs, NPs, FNPs. Even if we know what the abbreviation stands for, we don't always know the differences between the types of healthcare professionals and what they're qualified to do when providing care. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Today we'll talk about some of the healthcare professionals out there, especially nurse practitioners. Stay with us. Welcome back. Joining us this morning is Erin Kunzweiler, a family nurse practitioner. Thanks for being here, Erin.
You're welcome. Thanks for having me.
What is a family nurse practitioner?
So when we talk about nurse practitioners in general, we fall into the class of healthcare providers that are termed advanced practice providers, or APPs. So nurse practitioners and physician assistants would fall into that category. So a nurse practitioner is a registered nurse who's had a baccalaureate degree and then advanced training at the graduate level to become licensed as a nurse practitioner.
Can you talk to us more about the training and some of the requirements that you had to go through when becoming a family nurse practitioner?
Sure. So as I said, you first have to be a registered nurse and you have to have a baccalaureate degree. Then there's graduate school, which can be at the master's level or at the doctorate level. The requirements for that are, each institution has a little bit of a different requirement, but it would be based on your experience in nursing, how many years you practice, your GPA at the undergraduate level, graduate entrance exams. So those requirements have to be met, and then it's either a 2 to 3 year program, again, depending on whether you do the master's or the doctorate program. And so in that 2 to 3 years, the curriculum is classroom learning, where you're learning about disease and pharmacology. And then you have your clinical rotations, and those are out usually in the community where you came from, and you're set up with various mentors who have expertise in the specialty fields from family practice, pediatrics, surgery, emergency medicine. So after all of that is done, then you sit for the national board licensing exam, and once you've passed that, then you get your state license. Once you have both of those, then you're okay to practice in the state where you have a license.
When it comes to patient care, then, what are you able to do?
So as a nurse practitioner, your scope of practice includes assessing patients, diagnosing, ordering diagnostic tests, interpreting them, and then of course all of the follow-up that would be involved in that. We also have a big focus on preventative health care, preventative health care, so a lot of education is involved with that. So really the same as a generalist physician, but certainly you have to do it within your nurse practitioner scope of practice.
Where would a person receive care then from a nurse practitioner?
So in the healthcare arena, you'll find nurse practitioners pretty much in every setting. So you'll find them in private medical clinics, which is where I work, working for hospitals, either in their kind of family practice clinics, specialty clinics, urgent cares, emergency rooms, the prison system, the public health system, and then in education. So pretty much across the board in the healthcare arena, you'll find nurse practitioners.
Can a nurse practitioner have more than one specialty?
They can have more than one specialty, but I'll backtrack a little bit. When I talked about going to graduate school, there's several tracks that you can pick. So I did the family practice track. There's the nurse anesthetist track, psychiatric track, pediatric track, midwife track. So you can specialize initially in any of those tracks, and you would come out with certification then to practice in that arena. After that, though, you can get any number of specialty certifications, whether it's dermatology, oncology, cardiology, gerontology. And then, of course, depending on where you end up practicing, if you're, say, practicing in dermatology, you're going to sort of do an apprenticeship with, you know, the specialist physician that you're working with, and that's kind of hands-on learning. And sure, you can have multiple specialties, though.
Talk to us about why you chose family nurse practitioner as opposed to another specialty.
I think initially I like managing chronic diseases kind of across the board. I like to figure things out. And in family practice, you're kind of, you're taking care of patients across the lifespan from, you know, newborn to geriatrics. And you're presented with a wide array of pathology that you have to sort out. And I like doing that. Once you've kind of figured it out or, you know, sent them down the track of the specialists, you know, then it's a very more narrow focus. And that's why I chose family practice.
I believe that you also teach some courses at some point in your career. Can you talk to us about that?
Well, I did. I was teaching at Carroll College, nursing in the baccalaureate program, and I did that for about 4 years while I was still practicing, and that was a great experience. I think it made me a better nurse practitioner because when you have to teach, you know, everything like physical assessment, it certainly makes you a better practitioner. So that was a great experience.
So in closing, we've got just a few seconds left.
Okay.
What's your best advice to a nurse who wants to become a family nurse practitioner?
Practice as a nurse before going back to graduate school. Nurse practitioner school is not a medical school, and you really need to have a solid foundation in nursing before you go back to graduate school to become a nurse practitioner.
Thank you so much, Erin.
You're welcome.
We need to take a quick break, but coming up next, we'll talk about the differences between a nurse practitioner and a medical doctor. Stay tuned. We'll be right back.